We always spend a little time on Friday with our St. Vincent doctor, and today Dr. Anthony Fletcher is with us, cardiologist. Good to have you there.
Good to be here.
With St. Vincent and also Cardiology and Medicine Clinic.
Correct.
Yeah, well, thanks for being here, and we always get tons of heart questions. So let's open it up and see what we have. First on the phone lines, Debbie from Sheridan. Hi, Debbie.
Hi.
Hi. What's your question for the doctor?
Yes, I wanted to find out if there might be any long-lasting damage. I had a steroid injection in my spine back in December, and I have arthritis in my spine, and it had some... I had a lot of palpitation and shortness of breath, and since that time, I have been having kind of a soreness, seems like, around my heart, and some tightness where my heart is. I know that I probably should see a cardiologist, but I was wondering if you could tell me would there might be any long-term damage from a steroid injection. It was right across from my lungs and heart in my back.
Okay, thank you, Debbie.
Sure, thank you, Debbie. It's pretty unlikely that you're having a complication from one steroid injection, but as you said, probably the best thing to do would be to get evaluated by your physician and or cardiologist, just to make sure that something else isn't going on in addition to your problem that you got your steroid injection for. But steroids generally are safe to use. They do have side effects. Generally, it's associated with a long-term use of steroids, but basically, I think the most important thing is to be sure you don't have some other concomitant problem going on in addition to your need for the steroid injection.
She should probably see a cardiologist then pretty soon to have these
or at least her primary doctor.
Okay, very
Absolutely.
Good. Thank you so much, Debbie. Peggy is up next from Conway. Hi, Peggy.
Hi.
Go ahead.
My question is, my husband recently had a bunch of tests done, a Synscope. I don't know if I'm saying that right. Anyway, he came out with perfect health and everything, and they just said he had a low heart rate. They were not worried about something that we're worried about, and that is my husband has like bruises that have come up on the bottoms of his feet and his toes. And his feet are real cold all the time, and I don't know what kind of a doctor I should see or he should see, I mean.
Okay, thank you, Peggy.
Sure, thank you, Peggy, for the question. The bruises on his toes, certainly there are many reasons that those can exist. One of the things that we would think about from a cardiovascular perspective is perhaps peripheral vascular disease, or PAD, as is often described on the news media. That's something that can be screened for either by your primary care physician and or a cardiologist, just with some simple testing. A test we refer to as ABIs, or arterial brachial index, would be a good beginning evaluation. But again, I would start back with your primary care physician to just assess the general circulation of the lower extremities and make sure there's not some other problem going on besides a circulation issue.
Okay, very good. Thank you, Peggy. And Marianne is up next, and she's from Cabot. Hi, Marianne.
Yes, I do have a question for the doctor. I have a son that was born with a congenital heart defect and will be 18 in a couple of months, and was wondering when I could transition him from a pediatric cardiologist to another cardiologist and maybe get a second opinion. He is having his aortic artery, where they did the transposition of the greater arterial vessel, has been enlarging, and we're wanting a second opinion, but not necessarily from a pediatric cardiologist. When could I transfer?
That's a great question, and I think that the American College of Cardiology and cardiologists across the country are starting to think more and more about, as the congenital population ages, and they've done such a great job in treating congenital heart disease in the last several decades. We're seeing more youngsters now transitioning to the adult phase. Unfortunately, there's not a large number of people who've been trained to take care of both the congenital and adult. And so many times that transition should be a transition where you have an adult cardiologist involved, as well as your previous pediatric team to help in the terms of the assessment and workup of your current problem. There are a couple of physicians in the city who still continue to see young adolescents, young teenagers, and young adults as they make that transition. But I think most adult cardiologists work in conjunction with people with children and some of the other cardiologists who do see some congenital heart disease.
That is great. It shows the success in the pediatrics, that they're living longer, and now we need to transition them, and that's wonderful. All right, let's remind everybody, of course, about St. Vincent with Dr. Anthony Fletcher, and also Cardiology and Medicine Clinic. They're on 12th Street. The number is 664-0941 if you need to call and ask more questions, or if you think you need to set up an appointment there as well. We've talked many times about how the cardiologist sometimes is the primary care physician for people. Sometimes they just see you and you get all kinds of questions. But we thank you for coming in. Thank you as well. It is Heart Month, and that's one reason we wanted to concentrate on your heart today.